In this PowerPoint, we're going to focus on some personality disorder like borderline personality disorder or paranoid. So paranoid may be associated with childhood trauma or substance abuse or criminal behavior. When patients come to you with the personality disorder like paranoid, when you taking the history, you can find they have a past medical history of child trauma, child abuse, or long-term substance abuse, or criminal behavior. The borderline personality actually a group of disorder like antisocial, paranoid, narcissistic behavior, Histonic behavior, or borderline. Let me explain one by one. So first, the basic information about the personality disorder. So personality disorder include the various inflexible maladaptive behavior pattern or trait. Trait means particular character or nature that may impair the functioning and relationship. The client unusually remain in touch with reality. The difference between other psychotic problem, usually patients do not have any relation with reality, but borderline disorder or personality disorder, patient remains in touch with reality, and typically they a lack of insight on his or her behavior. So they thinking they are okay, but nobody is okay, and that is okay. But they thinking they are always 100% right. But as a human being, nobody is right. So the trace exacerbate manifestation of the personality disorder. In severe cases, the personality disorder may deteriorate to a psychotic state. In severe cases, we said. So in this PowerPoint, I'm going to figure out what are the different particular character with different kind of personality disorder and what are the nursing care. Keep in mind, because of our profession, we always provide the safety for the patient at the risk for self-injury or any kind of violence. Example, borderline personality disorder at the risk of self-injuries. Also, we should provide the limit and consistency. And we should provide assertiveness training for dependence and Histonic personality disorder. Whatever it is, we have to respect our patient, respect the need for the patient with whatever their personality disorder, like schizotypic or schizoid or any other disorder. What next? What are the character of personality disorder? They have a poor impulse control. Like acting out to manage the internal pain. So they are very dramatic. Their expression is too much, exaggerated expression. So the form of acting out include physical or verbal attack, self-injurious behavior such as the cutting their skin, banging their head, punching the self, or manipulation or substance abuse. Also promiscuous sexual behavior or suicidal attempt. Also, the client may be preoccupied with such things as self, religion, and sex. The mood characters may experience very depressed. Sometimes they are manic, sometimes they are depressed. Or mood may include guilty, fear, or emptiness. So, what next? Also, the impaired the judgment. Their judgment is not fair. Difficulty with problem solving, inability to perceive the consequence of behavior, impaired the reality testing, like distortion of reality and often projection of own feelings onto others. Every person is individual. Every person, emotions, their story, their lifestyle is different. So why I want to reflect my behavior to others, but paranoid person, they often projection of their own feelings onto others. Impaired object relations like rigid, inflexible. So if my character by nature is rigid, not flexible, it would be difficult to continue with my other family members. Difficult, right? In intimate relationship. Impaired the self perception, distorted self perception, and experience of self hate or self idealization. What next? Impaired the thought process, like diffuse thinking or difficult to get concentration, impaired memories. Also impaired the stimuli barrier, inability to regulate the incoming sensory stimuli or increase the excitabilities. Excessive response to the noise and light, poor attention span, agitation, and also sleeping disturbance or insomnia. Basically, it is difficult for them to adjust with the environment because they are not flexible. Their nature is very rigid. The personality disorder we categorized in three types: cluster A personality, cluster B personality, and cluster C personality. So cluster A personality disorder include the schizoid, schizotype, and paranoid. So first one, the schizoid personality disorder is characterized by an inability to form any kind of warm or close social relationship. Social detachment, lack of close relationship, or they always like to isolate themselves, or aloof or indifferent, restricted expression of emotion, lack of interest in others. So schizoid, basically emotional detachment is the characteristics nature or indifferent. Hmm? And what next? The schizotypal typal personality disorder is characterized by display of abnormal or highly unusual thoughts or perception, speech, or behavior pattern. So this type of personality people, they like to musical thinking or believe or perceptual distortion like suspiciousness, paranoia, musical thinking, or odd thinking, relationship deficit, right? So I'm thinking my coworker putting some poison in my lunch, or I'm thinking somebody in my family and always trying to harm to me, right? So type 1 personality continue, paranoid personality disorder. So usually this type of nature distrust and always suspiciousness to others. So they have a delusion of persecution, most common nature. Then what next? This disorder is characterized by suspiciousness and mistrust to others, or they are also rigid, hostile, argumentative, critical, or controlling of others. They like to control others. Also, they have a thought of grandiosity. They think they are all in all. They are right. So, nursing care, do not whisper or laugh in front of a client with a paranoid disorder because the client will think that you are talking about or you laughing at him or her, and this increase the paranoid nature. So what next, and what are the other behavior of paranoid? So they interpret the action of others as a threat to them, also perceive the dismiss missiveness by the others. Cluster B paranoid disorder like histrionics, narcissistics, borderline, and antisocial, right? So, in a short, let me explain what for what. The histrionic, the first one is histrionic, we said, they attention looking for. So they always attention seeking, sedative, and very always they're looking for to be the iconic, but they do not know how to become the iconic in a group, but they want to be the hero, but they don't like to be work like a hero in a group. And narcissists, like, they're very arrogant or need for constant admiration. So always you have to tell them they're good, they're good, they're good, whatever they are. And also the lack of em- empathy towards the others, like a Hitler, right? Narcissistic. Then borderline. So the borderline, they have a splitting behavior, or characterized the borderline people characterize the people or things as all good or all bad, emotionally liabilities or impulsive behavior. Their high risks of self-injury or suicide behavior. Antisocial, this nature is exploitatives or manipulation, and also deceit to others. Verbally, they're very charming, but fail to accept the personal responsibilities. They are antisocial. So let me read one by one. First of all, I said it is Histonic personality disorder. So the characterized by overall dramatic and intensively expressive behavior, right? So this type of character is characterized by a pattern of excessive emotionalities and attention looking behavior, or excessive need for approval, inappropriate seductive behavior, a need to be the center of attention. They want to get the center of attention, important to maintaining boundaries at all the times. So they are very dramatic and enjoy being the center of attention, has a poor or shallow interpersonal relationship, interpersonal, maybe sexually sedative or provocative, dramatized, and also overly concerned with their appearance, and also easily get bored. So, what next? So, what are the particular nature of histrionic personality disorder? So, they need to be the center of attention and feel uncomfort when not, inappropriate sexual and provocative behavior, use the physical appearance to draw off attention. So thinking or thinks the relationship are closer than they actually are. They are very dramaticals, but life is not a drama. So they easily get bored. They do not like their partner for a long time, right? Also exaggerated emotion, or 2 to 3% population like this. So what we do in the Facebook, always post the picture, show the others, I'm happy. Are you really happy? So the cluster B other type is narcissistic personality disorder, is characterized by an increasing the sense of self-importance or preoccupation with the fantasies and a sense of unlimited success. So this group of people has a grandiosity or preoccupied with fantasy of power or success. So I like to say the example of Hitler in German or Mao Zedong in China, who is the father of nation. But what are the story behind of him, right? So also explosion of others to achieve the personal goal or other, or often sensitive to criticism. So need for admire them. You always admire them, or inflecting of accomplishment, overestimation of abilities, and underestimate to contribute of others, right? You are all in all, we are nothing, whatever it is. So lack of empathy and sensitivities to the need of others. So when they need, they can do everything. They do not care because they have a sympathy is less. They're very arrogant and need for constant admiration, I said, and the lack of empathy towards the others, very common nature inside them. What next? Antisocial. So in this group, antisocial is a comprised of a pattern of irresponsible and antisocial behavior or selflessness, inability to maintain lasting relationship, poor sexual adjustment, a failure to accept social norms, or tendency toward irritabilities or aggressiveness. So they are poor impulse control. Also, disregard for others, unlawful action, also suicidal risks. So here we said what next? So perceive the world as hostile. World, rest of world is hostile. Only I am good and my uncle is good and everybody is bad. So antisocial personality, superficial charm or hostility, or no shame or guiltiness, unreliable, easy to get bored, poor work history. So when you take the history, you can see their professional life is very poor. Their sexual adjustment is very poor. The relationship is not lasting. Inability to tolerate or frustration, or views other as an object to be manipulated, poor adjustment and impulsiveness. So they always like to manipulation or deceit it to others, or verbally yet they are charming but fail to accept personal responsibilities. What next? Borderline personality disorder. Hmm? So borderline personality disorder is characterized by instability in interpersonal relationship, unstable mood or self-image, and impulsive and unpredictable behavior. So in this group of people who have a borderline, they are okay in outside. They're okay with their job because they have a relation with reality, but they make your life with their partner or in the family, others will other life they make miserable. So borderline is unpredictable, self-destructive behavior, unstable affect, and they have a suicidal rates, frequently display of inappropriate anger or impulsiveness, recurrent act of crisis, such as they like to waist cutting, finger cutting, overdosing, or self-injury. Hmm? So let me read it. Unclear identity, unstable, intense, extremely shift in mood, too much anger, easily to get bored, easily to angry, argumentative, sometimes depressed, self-destructive behavior, manipulation, inability to tolerance anxiety, also chronic feelings of emptiness, fear of being alone, also splitting behavior, characterize the people or things as all good or all bad. And also create the conflict behave between individuals by playing one person again others. So you see, so also they are high risks of self-injury and suicide. What next? The borderline personality disorder, basically the treatment option, group therapy, or some medication for mood and some medication for depression, it is works very well. What next? Cluster C personality, like anxiety, fearful type of personality disorder like obsessive compulsiveness, avoidance, and dependence. So, like I said, obsessive compulsive behavior. So, in this group of patient, high need for routine, basically. Also, limit but do not interrupt compulsive act. So, when you work as a LPN or RN or healthcare provider, when you interact with the patient who have obsessive compulsive disorder, what they do, better to limit it rather than stop it, right? You can limit, but do not interrupt compulsive act. Hmm? So they focus on perfection or order, and control that may prevent the patient from completing a task. What read? Let me read it. This disorder is characterized by difficulty expressing warm or tender emotion, perfectionism, stubbornness, the need to control others, and a devotion to work. So overly conscientiousness, inflexible, or preoccupied with deals and rules, extremely devotion to work, or also holding behavior or engaged in rituals, right? So in this group or obsessive compulsive, the treatment option thought stopping technique or anti-anxiety medication very effective, like benzodiazepine or SSRI, serotonin, selective serotonin reuptake inhibitor is response. What next? Here is avoidance, another character. Avoid social situation and interpersonal contact due to extreme fear of rejection or abandonment. And what is depends? Depend. So extreme dependency in a close relationship or need excessive input from others to make a decision. Let me explain more. Avoid personality disorder here. So what it is? Characterized by social withdrawal and extreme sensitivity to potential rejection and feeling of inadequacy. So when I'm falling in love and she reject me, then I'm looking for what is my lackings, feelings of inadequacy, hypersensitivity to reaction of others, and poor reaction to criticism, social isolation, lack of support system. Hmm? So, as I told you, avoid social isolation and interpersonal contact due to the extreme fear of rejection or abandonment. Next is dependent personality disorder. Is characterized by intense lack of self-confidence and low self-esteem, lack of ability to function independently, such that the individual passively allow to others to make decision and assume the responsibility for major area of person's life. The depends client has a great difficulty to making decision. So their extremely dependency in a close relationship, hmm, and also need the excessive input from others to make a decision, because the great difficulty of making decision. So now we are going to talk So what is the nursing intervention or interaction in case of personality disorder? Let me explain the nursing care. So maintain the safety, again, the self-destructive behavior, right? Safety is the most priorities. Allow the client to make a choice and be in as independent as possible, encouraging the client to discuss the feelings rather than act them out. Provide the consistency in response to the client acting out the behavior. Discuss the expectation and responsibilities with the client and discuss the consequence that follow the certain behavior. What next? Inform the client that the harm to self or others or or here. So encouraging the client to participate in group activity, set and maintain the limit to describe the manipulative behavior, remove the client from group situation which the attention looking behavior occur. Provide the realistic praise for positive behavior in a social situation. So what next? Next is here. Inform the client that I here provide the, so in a summary, what are the nursing care? So let me make it summary. Provide the safety for the patient at the risk for self-injury or violence. Example, borderline personality disorder at the high risk for self-injuries. Provide the limit and consistency. So especially for borderline and antisocial personality disorder. Also, we provide assertiveness training for dependence and Histonic personality disorder. And also, whatever the diagnosis of the patient, they have a right to get the respect. So respect the need for patients with schizotype or schizoid personality disorder to isolate themselves, right? So this is more than enough about the personality disorder, about borderline, antisocial, paranoid, narcissistics, and histrionic behavior.